Mercy Medical Center Mount Shasta is part of Dignity Health, a corporation with 43 hospitals. I'm proud to say that our little hospital in far northern California is the leader in patient satisfaction and top quality measurements within the corporation. But like many other rural hospitals, we used to have a real problem with high turnover rates. Years ago, I went to a conference where two professors from UCSF were there presenting their findings on recruitment and retention in rural healthcare. What they reported was that only 7% of people recruited from an urban area to a rural area stay long term.
Turnover in the hospital affects the hospital in every level, from the patients all the way from administration to housekeeping to everyone. When you don't have enough nurses to take care of the patients, then you can't admit the patients, and you're affecting the community that you're trying to serve because you can't treat them here. You're having to transfer them to another city to be treated. It's hard on their families, it's hard on their friends. It's hard on management when you don't have nursing because you're abusing basically the nurses you have, because instead of working their 40-hour week, they're now working a 60-hour week, and you're pushing them to burnout.
At that time, I met with the county superintendent of schools, who reported to me that we were losing our best and brightest students out of the area because there were no job opportunities or career opportunities for them. In addition to that, College of the Siskiyous had a small LVM program that was graduating maybe 7 or 8 students every year and a half. We looked at some of the reasons why. One, the upfront costs were very high for them. They had a high attrition rate because they were unable to find a part-time employment to assist them as they went through school. Based on those things that we were noticing and seeing, we created several programs that would help mitigate some of those problems. One was a job shadowing program where we advertised to our local community that they could come in and follow healthcare professions around to see if there might be a career they might be interested in. Secondly, the hospital, in conjunction with the College of the Siskiyous, created a work-study program which would allow the LVN students come to the hospital and get college credits and a small income to help sustain themselves while they're in school. This did several things. One, gave them a small income. Two, it developed a better foundation with their own education, and also developed relationships with the staff within the hospital.
Well, I knew I wanted to stay here in Siskiyou County because I have 3 children and this is where my family is. But I didn't feel that I had very many options. So with College of the Siskiyous, I was able to go through the LVN program and stay here with my family, and through their work-study program, I was able to make money while learning about what the nurses did in all the different departments of the hospital.
The job shadowing program and the work-study program proved to be so successful that the College of the Siskiyous had to petition the state of California to expand the LVN program up to 30 students. Shortly after that expansion, they wrote a grant with the hospital's participation and obtained funding to create a registered nursing program. Today, we're graduating 30 RNs a year through this program. This is a direct result of a collaboration between the college and the hospital. In addition to that, we created a scholarship program to help our local residents pay for the upfront tuition cost, their books, lab fees, physicals, and also to have somebody to help sustain them through that program.
I knew that I wanted to go on and finish my RN, but without Mercy's community scholarship, I don't think that I could have figured out a way to do that.
I think I'm a great example of what kind of support you can get from a local hospital to encourage you to not just have a job, but to have a career. The hospital offered tuition reimbursement for me. I received local scholarships that I was able to use for any financial help that I needed. Another great benefit of this hospital offering all these programs is that I'm able to stay here. I just recently got married and we're both local from Siskiyou County. We had no intentions of moving unless we had to, and we don't have to because the hospital has honored their commitment to me and I get to stay and work here.
Mercy has just had a unique way of developing and encouraging members of the community to participate in these programs, whether it be school and at work. They have encouraged me to continue on in school, and with the help of community scholarships as well, I was able to get through school with less of a financial burden, and always felt supported as far as work.
In addition to the scholarship programs, the hospital created a forgivable loan program. This was to help our employees go to school. We took staff who were working in positions such as a ward clerk, admitting, housekeeping, and paid for their school tuition and books up front. In addition to that, we looked at our leadership team and encouraged them to go and obtain higher education. We helped them obtain bachelor's and master's degrees. Our thoughts were that with further education they would become more effective leaders, and they have.
I started at the hospital 26 years ago in sterile processing, washing instruments and stocking supplies. I worked in multiple departments of the hospital while I was going through school. I got my LVN first, then went for my RN. The hospital helped me with a loan for my RN, and then a few years later I got my bachelor's and they helped me with tuition reimbursement. And then a few years after that I got my master's, which they offered me the forgivable loan program for. And that worked by signing a contract to work 3 years past my degree, and then my loans would be paid off. So my master's degree was in essence free.
So I started out in Mercy Mount Shasta in 1986 as the medical staff coordinator. I was in that position for about 14 years, and administration approached me and asked me if I'd be willing to do the quality director position here at the hospital. And I agreed. That was an unusual request because normally that position is held by a nurse. So part of that agreement for me to do that position was to go through nursing school, which is something I had always wanted to do. I've always wanted to be a nurse. So I worked with administration and they put me through the forgivable loan program in addition to utilizing the tuition reimbursement program. And I got my Bachelor's of Science in nursing through both of those programs. The trust and support that the hospital gave me in going through both of those programs is something that has stemmed a level of loyalty and commitment to this organization that I don't know that I'd get that in any other facility or any other organization. So I plan on being here throughout my career.
It became very evident that our programs were cost effective. To replace a registered nurse, one with experience, costs upwards of $60,000, more so for a pharmacist or other professions. So by investing into our local population, our local people, it helped the hospital both in quality and financially. In addition to that, it's helped our entire community. Again, we provide jobs, career opportunities, education opportunities. We help each other.
My wife was actually born in this hospital, and she was raised in this community. And I met her at College of the Siskiyous while taking prerequisites to get my bachelor's degree in nursing, a degree that I got through Southern Oregon University. So I met her taking classes together, and she also went on to become a nurse and also worked at this hospital for a while. And currently she's teaching in at the college. She's teaching medical terminology, and I'm also teaching. I'm teaching in the LVN program, and I've done it for 2 years now. I absolutely love it. It's a wonderful feeling to see students learn and become nurses.
I believe that our hospital, our patient, their family members are happy here. And personally, I'm very happy here. This is my home. And I know the people I work with, the entire staff, we are here for a reason. And the reason is good, to create better tomorrow. And I think we are happy. We are very happy. And I don't know if other hospitals, even those I worked before, could say that we are happy.
My husband was an employee here, and he started out as a respiratory therapist, and now he is he's the director of the cardiopulmonary department. We're both very blessed to have been able to work here and make Mercy a part of our home. We're vested in this community and the family of Mercy.
Our solution for retaining and creating great staff was right in our backyard the whole time. The programs we created, the job shadowing program, the work study program, the scholarships, the forgivable loan programs, all combined helped us become very successful. What's exciting about this, they're sustainable and cost effective. It allows us to make sure we have a professional, dedicated staff, not only today, but for the future as well. This enables us to care for our community, and after all, that's what we're here for.